Hi, I'm Dr. Tony Mork, author, speaker, inventor, board-certified orthopedic surgeon, and endoscopic spinal surgeon in particular. And for the past 13 years, I've dedicated my practice entirely to the cure of chronic neck and back pain without the use of a fusion. Today, I'd like to talk about Facet syndrome or spinal arthritis. This is a situation that is really one of people that are a little older are going to get. It's not a young person's disease, it's an older person's disease, and it's progressive. It occurs somewhere between, again, it probably starts almost at zero and can account for 40% of low back pain complaints as we certainly get into our 70s and 80s. The problem is as a result of the facet joints, and the facet joints are the guiding joints in the back of the spine. They occur, this is the back, or the little bumps on one's back where you get a massage. These are the little facet joints off to the side. In the front, we can see the discs here between the vertebrae. And I think that it's easy to understand that with just as we age, we get shorter. One of the reasons we get shorter is because the discs lose their water content. As that happens, the facet joints, which were born on center, get off center. And as a result, we have three things that can happen to the facet joints at that point in time. But let's talk a little bit why the facet joints would hurt. The facet joints are actually lined with synovial tissue, which has got a fairly good and sensory nerve supply. In addition, the joint is covered by a capsule, and the capsule has a very sensitive nerve supply as well. These both act to restrain the motion of the back. So in addition to the nerve supply telling the brain where the back is in three-dimensional space, and the bone acts as a bumper so that it restricts our range of motion, say when you're swinging a golf club, that you just don't keep twisting around. The problem becomes one of aging, where we begin to lose the water content in the discs. The facet joints get off center, and when that occurs, bone-on-bone contact can occur, pinching of the soft tissues, the synovial tissues in the joint can occur, and stretching of the capsular tissues can occur as well. In addition, osteophytes, which is again another byproduct of arthritis, can occur, and these can actually pinch the soft tissues as well. In my experience, the back begins to hurt in the morning in particular, with a feeling of stiffness and pain that's off the midline. So it's not directly in the center like the disc would hurt. It's a little bit off to one side or the other or both sides. And initially it can be dealt with rest. Maybe anti-inflammatories will carry you for a few years. Things like golf and twisting can be aggravating, as is extension. So when you lean back, oftentimes that will aggravate a facet problem. If symptoms persist, you oftentimes might find yourself in a pain management office, and where injections of maybe Novocaine and some cortisone can occur. This helps to make the diagnosis and may treat the problem on a temporary basis, maybe from 3 weeks or 3 days to maybe a year. It's just unknown, but at least it helps to make the diagnosis. If that doesn't work or it lasts on a temporary basis, the next treatment is usually radiofrequency. This is done with placement of a RF or radiofrequency probe by the pain management doctors down into the area of concern near the nerve supply. And the radiofrequency will block the nerves, and only on a temporary basis, which is the problem. It can last from a few months to a year, and then the pain starts to come back. So if this sounds familiar, maybe you've sought out a more permanent kind of a solution and stumbled over the fact that one permanent solution is a fusion, which in my opinion is a tremendously large operation, long recovery, and only working maybe 2/3 of the time, a pretty dramatic time of a fix, maybe creating more problems than you're solving. I began to look at the problem in a different way a number of years ago. With the endoscope and looking directly at the facet joint, I could see that the problem was this pinching of the tissue. So with the laser, I began to actually remove the tissue from inside and actually remove a portion of the capsule, which conducts the nerves. And between this, I began doing this in the cervical spine, thoracic spine, and lumbar spine. And over a period of time, I got to see that the patients seemed to do fairly well. As a matter of fact, last year, my associate, Dr. Scott Hoff, and I got this paper published in 2010, which is the original paper talking about endoscopic facet debridement with the use of a laser. And in this paper, it was noted that in a combination study of cervical, thoracic, and lumbar facets, that between 68 and 77% of the patients had at least 50% relief of their pain after a minimum 3-year follow-up. So people were getting rid of at least half their pain 3 years out at least. So it was long-acting, and it seemed and it had very safe. There's really minimum of complications noted. I think the benefits of this type of treatment are, one, it's essentially permanent. When at least 3 years out, people got at least 50% relief of their pain with a simple outpatient procedure, and there was a very little downside risk. If the pain didn't go away, it didn't get worse. And so I think an endoscopic facet debridement is a great alternative that's long-lasting in nature. At the end of this, I also will show a short clip of the surgery as I get to see it, looking inside the facet joint and with some treatment with the laser. And I'd like to thank you very much for looking at this. If you liked it, please give me a thumbs up and or subscribe to the channel. If you've got further questions, you can visit me at drtonymort.com. I appreciate it. Have a great day. Thanks.